Hi friends, family, and strangers. My name is Leslie Jocelyn. I have a brother named Javier, Javi as we like to call him, who has AML, the type of leukemia. This is his second time battling cancer, and that all started 2011. He had a bone marrow transplant in June 2011. Looks like he had beat it during 2012, at least for the majority of it. We thought he was cancer free and things were going well. On Christmas Eve of this year, 2012, we found out that he had leukemia again, just a different form this time. While the last transplant was a success, turns out that the stem cells that they used from the umbilical cord were kind of tainted. The baby that the umbilical cord came from has the gene for cancer and might have cancer as we speak, or they might be trying to prevent it now that they know that the baby has the gene. Now, we waited a decent amount of time to find that match, but just because my brother found a match last time doesn't mean we're gonna find it this time. That's why I'm masking video, so it doesn't seem like I'm just some spamming post everywhere. You can see I'm a real person. My brother's a real person. He would probably be in this video except for I'm sick and I'm not allowed to be near him when he's sick, and he's currently in the hospital receiving chemo treatments. Now, before you say, oh my gosh, bone marrow donation is crazy, it's painful, there are some things that are true and some things that are not, that you have these preconceived notions. So first off, if you join, it's very quick, it's easy. They send you this basically like a Q-tip, you scrub it inside your mouth. You sign up online at Be the Match. You can go to marrow.org, and from there they have some questions also. They have to make sure that you're in a decent amount of health to donate, and once you're on the registry they can call you up either as soon as you're on there or years later, or they may never call you. But if you are called, more than likely they're going to have you do peripheral blood cell donation. That's the most common kind. It's like giving blood. They filter it out through a needle. They'll filter your blood for the cells they need, and then they'll put the blood back in you. Even for that, you are going to have some discomfort. They have to give you some medication days before to help you increase the production of the cells that they need. So I can't say that it's going to be painless, but it's uncomfortable, but it's not unbearable. In some cases, there is a need for surgery for them actually taking the marrow out of you through your hip bone. That one, yeah, you're gonna feel more uncomfortable than if you had donated through the peripheral blood cell donation, but you're saving a life. And honestly, compared to the patient, it's not the same, and you probably won't experience half the things that they have to go through to make it work. Last time they had to radiate my brother's body so they could kill off his immune system, basically, so they can make way for the new bone marrow, so they can get a new immune system started there. And he was burned. He had pretty bad burns on there from the radiation, and not just that. Maybe a couple weeks after the bone marrow transplant, he had graft versus host disease, and his organs started shutting down, and my family and I, we basically said goodbye, expecting him to pass away, but he made it. And if he's willing to go through that again, So, get a chance to live. I would really appreciate it if you would even consider it. I know it's a lot to ask. And there's a lot to consider just before you say no, and even before you say yes. I think you should look into it. Ask me any questions if you have any. I'm more than ready to, answer you. Just, think about it. And if, it's not for you, think about donating money. It does cost money to the registry to pay to get all these donors on there. And, if you do donate, it doesn't cost you anything. The registry will pay for everything, all the medical things involved. And, yeah, just really think about it if you wouldn't mind. Thank you.